trust is really the key word here, because medicine needs trust. I mean, patients are trusting medical doctors. You don't want to go and see a medical doctor if you don't trust him. When you go to a hospital, you have to trust the hospital. And when the doctor or the hospital starts to use AI systems, you as a patient have to trust into the whole system, into doctors, radiologists, and the hospital using AI algorithms. And of course, we need to have trust in the algorithms somehow. So transparency certainly is one of the big problems. And how can you build trust and ensure transparency? One way is to really extensively test your algorithm, and that comes back to the question of validation data sets. Another way could be to have what we call explainable AI, making transparent to the radiologist why the AI system has arrived to a conclusion. So this is something much discussed these days. And another way could be, and that's something contextflow is doing, is to work together with a radiologist to reach a decision, meaning that you can make proposals to the radiologist and tell him, well, this looks very much like other examples from a database where we know what it has been, and then guiding the radiologist and helping him in his decision by also referring him to a knowledge database. And this, and I think I've already been saying this, and this is, I think, a clever way to make a system transparent to the user.
I think ultimately we all kind of trust our personal inner circles, right? And especially when you're learning as a radiologist, there's always that specialist that you know, I can go ask Dr. Smith because Dr. Smith is a specialist in this area. And so ultimately, one of our goals then would be to make a hospital's index searchable, so that when you say, oh, I know I had a case like this before, but maybe it's even been a couple of years, I don't remember how do I find it? Mm-hmm. I think that's what we're trying to do. Again, so it was your decision back then and it's still your decision now, but maybe it helps reduce some of the double thinking process or the double research process that you have to go through.
Exactly.
So.